Choose to become a nurse, okay. I graduated when I'm 18, okay. And then, yeah, I think I want to be Nightingale, just like helping people, you know, helping sick people. It's not I need to, it's I want to. Yeah, I want to help people when they are sick, they need help. Okay, anesthetic nurse, normally if you are doing everyday's job, you know, just like a routine things you are doing, okay? But sometimes, like you have a patient with the difficult airway, you know, and this is a problem to maintain the patient's airway, and then the anesthetic nurse is really important. So you make sure that you got everything that they need there and help them properly, you know when to give suction, you know what sort of equipments they want. So you have everything there, and then, you know, it's, you can save life. Otherwise, if you can't maintain the patient's airway, the patient can die. No, nursing care is different. Of course, it's a, you know, theater, patient having operation, okay? Psychologically, you have to comfort the patient, make sure that they are comfortable, and you have to look after the patient during the operation as well. The patient is asleep, all right? So they can't look after themselves. So nurses and doctors, they are the one who actually have to look after the patient for the patient's benefit.
I think it's important to care about your patients, because otherwise, you know, given that the pay is not as high as other professions, like, it takes a special person to care enough and cope with the stresses of the job.
I work from 7:30 to 4, all right? So that's all scheduled. So you have a list starting from 8 o'clock till 4. Sometimes we normally won't finish by 4 o'clock. So either you have to stay back doing overtime, or they have someone to relieve you. So, you know, finish whatever the list going, and then they finish. Maybe sometimes around 9, 10 o'clock in the afternoon. I've been in Australia for working for nearly 20 years. Yeah, nearly 20 years. So I work in theatre all the time. But in Hong Kong, I graduate the normal training, and then I 1 year doing midwifery, so midwife, and then I work in some medical ward, surgical ward, and then I went into theatre. So that's why I choose to work in theatre. The basic thing is you care. Yeah. So care is very important. Yeah. So, you know, you care of people, you care of your patient. So if you care, of course they will be looked after properly.
I definitely think patients are in good hands, and I wish like there were more nurses like my mom.
Because I have experience, so they're really wary of my experience, and they all happy to work with me. And yeah, I look after my patient properly, and yeah, really appreciate. I think the job is valuable. So you do the job, you help people every day, so you feel good. And then people appreciate, you know. Some patients, they come back and they say, oh, okay, thank you very much. And when they know you feel good. Am I happy that I choose this career? It's a difficult question. Because people change their mind all the time. When you have a bad day, of course you say, oh, why I choose nursing, you know. But I think it's not a bad choice.
Do you think you're a hero?
Sometimes.